Hello, my name is LEPARAN GODWIN, roll number BP 1650112 from group number 40, and today I'll be presenting the topic cirrhosis. What is cirrhosis? Cirrhosis, commonly known as dry skin, is a condition of rough, dry skin with fine scaling and occasionally with small cracks in the skin. Dry skin is also known as winter itch or osteoarthritis. Often itchy, dry skin is caused by environmental factors such as cold weather and frequent bathing, and by medical conditions such as atopic dermatitis and malnutrition. This dry skin develops due to a decrease in the natural oils in the outer layer of the skin, which makes the skin lose water. Who is at risk of having or getting this condition of dry skin? This can be seen in people of any age, of any race, and of either gender. However, the incidence of dry skin increases with age. Nearly all individuals over the age of 60 have some degree of dry skin. There are some environmental conditions or factors which can cause cirrhosis, which are low humidity, frequent bathing, harsh soaps. Dry skin can also be caused by different medical conditions, which include ichthyosis, atopic dermatitis, diabetes, hypothyroidism, Down syndrome, liver or kidney disease, malnutrition, HIV and AIDS, and lymphoma. The signs and symptoms of cirrhosis. The most common locations for dry skin include legs, especially the front of the legs, that's the shin, arms, trunk, especially the side areas between the bottom rib and the hip, back of the hands. Dry skin appears as a dull, rough skin with fine scales that flex off easily. In more advanced stages of dry skin, the skin may have cracks that resemble a dry lake bed, and inflammation of the areas may lead to pink or red patches. And sometimes this area it may be asymptomatic, that is, it can be completely without any symptoms, and sometimes it can be mild to severely itchy, though more inflamed skins tend to be mild to severe itchy. There's some self-care guidelines which can be recommended to patients or people who have such conditions. That is, first, the healthy bathing habits, such as which can improve the dry skin, which are to take bath or shower only once daily, because more frequent bathing can make the skin lose water. That is, it will dehydrate the skin. Instead of taking shower with hot water, we should recommend the patient to take a shower with lukewarm water. Also, they should limit the time for bathing to be approximately 15 minutes. Also, they should avoid harsh deodorants. Use non-soap cleaners. Pat the skin dry after bathing. That is, they should not rub the skin while drying themselves. That's after taking a shower. They should also apply moisturizer immediately after bathing, while the skin is still moist. When choosing a moisturizer, look for oil-based creams and ointments, which work better than water-based lotions. The following over-the-counter products may be helpful in the condition of cirrhosis, which are petroleum or petroleum jelly, which you can find them commonly as Vaseline. Also, fragrance-free creams or ointments. Preparation containing alpha hydroxy acid, such as glycolic acid or lactic acid. Creams containing urea. Over-the-counter cortisone cream, that is if the areas are itchy. Topical antibiotics may be applied immediately to any cracks in the skin to help prevent infection to the skin. Also, use a humidifier in the bedroom during the cold, dry season, such as winter, to help prevent the skin from drying. One next point of focus is we're going to focus on when such a person should seek medical care. If the above self-care guidelines cannot help the patient to uh, relieve the dry skin, he or she should seek an appointment with a doctor for further evaluation. We're going to focus again on complication and differential diagnosis of cirrhosis. But first, let's check on complications. This condition may result from the drying effect of dermatitis may result from the drying effect of soaps, detergents, or other irritants such as alcohol that are applied to the skin alone or are contained in skincare products. So, if someone has an history of this such a condition, he or she should avoid any skincare products which are alcohol based. Dry skin may also cause fissures or cracks, which may irritating substance may enter the fissures and excoriations, causing the skin to become red, itchy, swollen, or painful. When this occurs, the condition is referred to as eczema crical or acidotic eczema, and pharmacists should encourage treatment interventions in this table 1 to help patients avoid complications and other possibility of further irritation, friction, and skin breakdown, which may make the skin susceptible to infection. The differential diagnosis of cirrhosis. Let's start with atopic eczema. This is seen in early life than cirrhosis, and its dry skin in younger individuals is more often a manifestation of atopic eczema and is generally more responsive to topical steroids than to moisturizers. Other type, let's go to autosomal dominant ichthyosis, which its onset of this condition is at birth or infancy. It is associated with excessive accumulation of scales prominent on the neck and trunk. In the absence of positive family history, a very mild form of the condition may be indistinguishable from cirrhosis. Nummular eczema. Its lesions associated with this condition are usually round and unlike the tessellated or mosaic-like appearance seen in cirrhosis. That type is status dermatitis. This is characterized by hemorrhage into the skin of the lower legs that is not seen in cirrhosis. Prophylaxis or treatment of cirrhosis. In general, there is a twofold approach to the treatment of cirrhosis. One is minimizing the irritation, and the second is moisturization. A patient should be instructed to limit bathing, especially in soapy baths that strip oil from skin and leave it chapped. It's recommended bathing once daily in warm water and mild soap, or bathing only every other day and supplementing with sponge baths of the axilla and anogenital areas, since these are rarely affected by cirrhosis. Patting the skin dry instead of rubbing can also help. Detergents, rubbing alcohol, and skin care products that contain alcohol and other drying agents should be avoided if possible. Irritating materials such as wool should not be placed next to the skin. In general, moisturization through frequent and liberal application of emollients is recommended, especially after bathing when water can be trapped in the skin with an occlusive agent. Moisturizers have water-retaining and lubricating properties and exhibit weak antipruritic, anti-inflammatory, antimitotic, and vasoconstrictive effects, which make them suitable treatment for mild eczematic cirrhotic skin. The generous and frequent application of moisturizers that contain lanolin or white petrolatum effectively traps and retain water in the skin. Scented emollients are not recommended to avoid skin irritation and contact sensitization. Emollients have few side effects, usually confined to contact dermatitis, folliculitis, and miliaria. Senior citizens, that is the elderly people, should be also informed that while over-the-counter emollients may vary greatly in quality and cost, there is no strict relationship between the two. What they should be advised is always check the labels of for ingredients, which can help these medical conditions, ingredients which they should be most avoiding is products which have alcohol or fragrance, which may provoke an allergic dermatitis. Also, they should adhere to regimen that requires a thick, greasy ointment, such as petrolatum, to be applied under their garments. Creams and lotions that contain urea or alpha-hydroxy acid are used to hydrate skin and remove scales and prevent symptoms. To increase indoor humidity during the winter, a humidifier may be helpful. Typical corticosteroids may be required if the skin becomes temporarily red, and we may use topical steroid ointments such as hydrocortisone with 1% or 2.5% is recommended. The pattern of cirrhosis may be seen in some drug reaction. A drug may have the potential to worsen cirrhosis by changing the chemical composition of the skin layer. Let's check on treatment that a physician may prescribe for a person having cirrhosis. The physician may prescribe cream containing alpha or beta hydroxylic acid that is glycolic acid, lactic acid, or salicylic acid, or urea-based creams, preparations containing high concentration of propylene glycol, corticosteroid cream. If the physician suspects the medical condition is causing your dry skin, then he or she may also do blood tests or other diagnostic procedure. Let's go to a sample case study of a patient having this medical condition. A 60-year-old man requests consultation for severely dry skin. The dry skin has been present for as long as he can remember, and several other family members are similarly afflicted. Examination reveals marked cirrhosis with a fish scale pattern of both lower legs. The patient has a BP of 140/95. The chief complaint here is a 60-year-old male with severely dry skin, and the onset of action of his medical complaint is an undated period of time because it's as long as he can remember. He has been having it for a very long time, and this medical condition is located at both lower legs, and it is characterized by a marked cirrhosis with a fish scale pattern. Patient has a BP of 140/187. Let's move to the assessment. The classic fish skin stigmata of Ichthyosis vulgaris is a result of dysregulated keratinization in the skin. This abnormal keratinization is associated with mutation in more than 50 genes encoding for proteins and is enzymes involved in integral cellular functions such as skin barrier homeostasis. Abnormalities in these cellular functions lead to epidermal hyperplasia or the formation of excess stratum corneum and the characteristic scale skin this patient has. So the treatment is focused on reducing the scale and dry skin, which will go to non-pharmacological management, that is taking baths as often as directed. This soaking helps hydrate your skin and soften the scale. Also, reduce the scale during your baths. Soaking in water often softens the scale, and the dermatologist may recommend that you reduce the scale while it's softer by gently rubbing the scale with an abrasive sponge, bath puff, or pumice stone. Also, you should apply moisturizer to damp skin with 2 minutes of bathing. Moisturizer can seal water from a bath or shower into your skin. The dermatologist may also recommend a moisturizer that contains an active ingredient like urea, alpha hydroxy acid, or lactic acid. These and other active ingredients may also reduce scale. Also, you can apply petrolatum jelly to the deep cracks, so this can help get rid of the deep cracks. Also, if there's any skin infection or the patient may develop skin infection, the dermatologist may treat with certain antibiotics, topical antibiotics. If the person gets frequent skin infection, dermatologist may recommend adding a small amount of bleach to the bath of patient, and this can help reduce the amount of bacteria on the skin of the patient. If the ichthyosis is severe and fails to improve with baths, moisturizer, and scale remover, the dermatologist may prescribe some medications, such as topical alpha hydroxy acid, such as ammonium lactate, are the mainstay of treatment, and this work by decreasing corneocyte adhesion in the outer stratum corneum twice daily. Patient management. Let's focus on the patient management having this type of condition. Generally, patients having different type of cirrhosis, apart from this type of inherited strain type of cirrhosis, they generally respond well to the therapy, and usually the treatment is focused on decreasing inflammation And in older patients, caretakers should monitor clothing, nail length, and other general precautions to prevent worsening. And geriatric patients generally have comorbid complications along with cirrhosis. Topical therapy is the mainstay of treatment, but systemic therapy is also beneficial. The clinician should be aware of all complications with the patient before starting any systemic therapy to prevent counteractions with other medications or conditions. Thank you.